Hello everyone. Now we're gonna present our project, Depression amongst Thai teenagers. The members in group are Nongnapat, Thanawat, and Supisara. Next, this is our outline that we will talk in this presentation. It including introduction, ideal situation, research methodology, research results, interpretation of results, and the last one is the conclusion. First, start with the introduction.
Depression in young people has been a global health concern in the last decade. A study in Thailand reported that the prevalence of depression in teenagers was 14.9%. Depression during teenagers may represent lifelong persistent depression that is associated with early manifestation of functional and interpersonal maladjustment. These are several factors which can cause depressions amongst Thai teenagers, such as social media addiction, the change in brain chemistry, and stressful life events. It was found that social media addiction among high school students could be associated with abnormal general mental health status, somatic symptoms, anxiety and insomnia, social dysfunction, and severe depression. Moreover, depression caused by a chemical imbalance in the brain can lead to many symptoms, such as feelings of sadness, restlessness, irritability, lack of energy, and extreme mood swings. These problems could also lead the teenagers to have a high percentage to use drugs and drink alcohol. Hence, clinicians should carefully adjust their practice due to the depression. Therefore, finding the solution to deal with the depressions amongst Thai teenagers could help to prevent them from abnormal mental health status. Recently, depression in teens is difficult to diagnose because moods alternate over a period of hours or days. Depression during teenagers is often accompanied by other biopsychosocial or behavioral problems, which can lead to additional difficulties in diagnosis. Teenagers' depression is presently classified in the revised 4th edition of the Diagnostic and Statistical Manual of Mental Disorder, and is diagnosed as at least one of the two core symptoms, depressed mood or loss of interest or pleasure. The effects of depression are long-lasting and can be felt in the overall quality of life. For the treatment of depression, people with depression basically cure by both medications and psychotherapy. The doctor will prescribe medications to relieve symptoms, while the psychiatrist or psychologist will relieve patient mental health through the psychotherapy process. For example, talking about patient condition and related issues is the kind of treatment which help to figure out problems resulting in depression. Therefore, it is essential to study the solution of depressions amongst Thai teenagers to prevent the risk factor that produce depression symptoms.
Next is about the research methodology. In this part, the aims of the report is to understand all of the factors that make the teenage be in depression. The first step is to brainstorm all of the factors for the depression, and the group members will see their opinion that they did the research and choose the 3 solutions that can help to reduce the depressions amongst teenagers. The next step is to use the search engine. In this research, the article have been found by searching in the search engines such as Google Scholar to see the research about the depression both on teenage and adult. And the most important thing that the group want to form the research are about the difference and compare the positivity statistic for each age. From many research that group member decided to have the best 3 solutions that could help to deal with the depression among Thai teenagers. The solution that the group members use are cognitive behavioral therapy or CBT, medication, and the brain stimulation therapies.
The first solution which can solve the problem is CBT, or cognitive behavioral therapy. Cognitive behavioral therapy is a kind of psychological treatment that was developed through scientific research. It is designed to teach a person to adjust negative speculation and behaviors by providing more positive and accomplished solutions. The patients will learn to access the negative speculation which they have about themselves and their view of the world, then recover them with more positive and constructive speculation and behaviors. Besides, the patient and therapist will consider the two escape routes leading out of the depression, such as what you do and how you think. CBT is one of the most effective treatments for the management of anxiety and depression. All of the components of CBT have been tested by researchers to determine whether they are effective and that they do what they are intended to do.
The second solution to deal with depression in Thai teenagers is medical treatment. There are many different treatment options available, so make sure that they make decisions with physiatrists to find the most suitable and effective way. But before that, a doctor may determine a diagnosis of depression based on physical tests, lab tests, physiatric tests, or DSM-5. It is so many types of antidepressants are available to help, but be sure to discuss possible major side effects with a doctor or pharmacist. The most popular of medical type are SSRI, SNRI, and atypical antidepressants. Selective serotonin reuptake inhibitors, or SSRI, is the starter medicine that doctors often offer to patients. These drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. It includes many of the medicine below in the slide. Serotonin norepinephrine reuptake inhibitors, or SNRI, is the upper level of antidepressants since it is more effective but also have more levels of side effects too. SNRI include the medicine below in the slide. For the last one is atypical antidepressant. This is the medication that don't fit nearly into any of the other antidepressant category because it is more help to make people sleep easily and reduce anxiety. They include bupropion, which help to deal with the insomnia problem. This solution will help directly to deal with the problem of brain chemical, so the patient must follow the rule of taking medicine strictly, and for Thai teenagers require permission from their parents to meet the doctor and take a medicine.
The last solution is about the brain stimulation therapies. When the depressed patients are not responding to other methods as we mentioned above, or have a bad depression like hurt themselves, the brain stimulation therapies are the safest way and do not dangerous as many people understand. The brain stimulation therapies have two things, which are electroconvulsive therapy, or ECT, and transcranial magnetic stimulation, or TMS. The electroconvulsive therapy is the way that the patients will take an anesthetic, intentionally triggering a beep signal. It seems to cause change in brain chemistry called neurotransmitter that can quickly reverse symptoms of certain mental health conditions, and it helps the patients with severe depressive disorder that other treatment cannot do immediately. Although electroconvulsive therapy may still cause some side effects, such as tolerant headache, or some patients may have the temporarily lost their memory. And next, the transcranial magnetic stimulation is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve the symptoms of the depression. This treatment for depression involves delivering repetitive magnetic pulse, so it is called repetitive TMS or RTMS. Although transcranial magnetic stimulation may still cause common side effects, including headache and scalp discomfort at the site of stimulation. Next is interpretation of results. To solve the problem of depression amongst Thai teenagers, group members selected three main solutions to help the patients. And the first solution, which is the easiest way to solve the problem, is cognitive behavioral therapies. And this solution will help the patient's feelings in a better way by looking at the things around them in a positive way. It may also help the patients become aware of what caused their depression and change their behavior to stop the depression. And the next solution is the next step of the treatment, which is the medical treatment. The medical treatment helps to balance the brain chemicals that control emotions and stress in the patients that have severe symptoms. There are many types of the drugs that the patients can choose, and the patients may have to try changing the drug that will get the best result and have the least side effect to themselves. And the last solution is about brain stimulation therapies. Brain stimulation therapy is the safest way and do not dangerous as many people understand. The brain stimulation therapies are the therapy that treat by using the electronic and magnetic field to change the brain's chemistry balance. And after comparing these three solutions, the way to help teenagers who are depressed is using the cognitive behavioral therapy first. And if the cognitive behavioral therapy is not working well, then the doctor may use the medical treatment to help the brain chemicals stable. But if the patients still have a bad symptom, the patients need to have a brain stimulation therapies, which may cause some side effects.
In conclusion, as research the problem and solution of depression in Thai teenagers, there are many ways to deal with it, such as CBT, medical, and ECT and TMS. Cognitive behavioral therapy or CBT, designed to teach a person to adjust negative speculation and behaviors by providing a more positive and accomplished solution. To make a medical treatment for Thai teenagers require permission from their parents, then can start the process. Medical treatment can be categorized into three types, which are SSRI for the beginning, SNRI for the harder case, and atypical antidepressant to deal with the sleep problems. Electroconvulsive therapy or ECT helps the patient with severe depressive disorders that other treatment cannot do immediately, but it is still cause some side effects such as tolerated headache, or some patients may have temporarily lost their memory. Transcranial magnetic stimulation or TMS involves delivering repetitive magnetic pulse and also cause common side effects including headache and scalp discomfort at the site of stimulation. By the way, no matter what the reason is, everyone can help to detect and suggest them to see a physiologist to find the most suitable treatment for each person. It would be nice if someone hold their hand and stay by their side while they are in the worst situation in their life.
And that's all of our presentation. Thank you.